Today we are going to discuss about nomenclature of monoclonal antibodies. Monoclonal, the term itself says those antibodies are targeted towards single antigen, whereas polyclonal is towards more than one antigen. Now, naming monoclonal antibodies. Usually, monoclonal antibodies end with MAB. For example, abiciximab, basiliximab, donezumab, etc. And before MAB in the whole name, for example, abiciximab. In the whole name, it ends with MAB, and before MAB, usually the source from which it has been extracted is given, and this is the mnemonic. Here we go. ZU, usually humanized, not completely human but humanized, and only U, complete human. The source of production is completely from human. And XI stands for chimeric, some kind of synthetic. And before that, before source, this particular thing, before source, it denotes the target to which that particular monoclonal antibody is targeting. Example, CI stands for circulation, circulatory issues are being answered, and S for skeletal, VI for virus. Let's see one example. Here these are the three monoclonal antibodies. Donezumab, the MAB says it is a monoclonal antibody. SU, only U, says it is completely human source, and S stands for U stands for the source, and here the S stands for skeletal. Therefore, donezumab is used to treat bone loss in men as well as women. Usually it is given along with the chemotherapeutic drugs for those who is suffering prostate cancer or breast cancer in women, because most of the drugs cause bone loss or osteoporosis. So this thing or this drug, this monoclonal antibody, is being given along with those particular drugs to those people to prevent or treat bone loss. And abiciximab, the second example, is MAB says antibody, monoclonal antibody. XI stands for chimeric, some kind of synthetic, and CI stands for circulation. Therefore, abiciximab is a anticoagulant, 2V3A receptor antagonist, which is useful for preventing clots, therefore used for circulatory issues. And palivizumab is a antiviral monoclonal antibody. MAB stands for monoclonal, Z stands for humanized, ZU stands for humanized, not completely human, humanized, and VI stands for virus. Palivizumab usually given to treat upper respiratory tract infections, for example RSV. Therefore, this is how nomenclature of monoclonal antibodies is done.